Please, guys, if you see me online on Facebook Live, please, guys, let me know. Thank you very much. So, guys, please, guys, if you see me live on the Facebook, please, guys, let me know. Thank you very much. We're just waiting for everyone and then start the session straight away. Thank you, guys. Okay, guys, we're just waiting for everyone and then we'll start the session straight away. Thank you. Okay, guys, am I live, guys, on Facebook? Guys, am I audible to everyone? Please, guys, if I'm audible, please let me know. Thank you very much. Let me check the Facebook right now. Okay, guys, seems like I'm live on Facebook. I can see here. Guys, there is any echo? Any echo, guys, or things is clear? Please, guys, if there is any echo, please let me know. Thank you very much. Hi, Dr. Fatima, how you going? Hi, Dr. Planati, how you going? Dr. Seda, how you going? Dr. Hassan. Dr. Musa, how you going? Dr. Shiva, how you going? Thank you, Dr. Fatima, letting me know, and Dr. Seda, letting me know. Okay, guys, let's start right now. Hi, Doctor, how you going? Your name is in Russian, so I'm not quite sure what did you write down. I'm sorry, I know you said hello, Dr. Bedo and everyone, but I'm not quite sure how I can pronounce your name. But how you going? I hope you're doing great. Hi, Dr. Arpit, how you going? Okay, guys. This is the first class ever for September 2026 champions. And I plan to start with trauma guidelines. Because trauma guidelines is the most important topic in ADC exam. Based on my experience, I believe trauma cases most likely is one of the cases you get an exam. That's why I plan to start the first class for September 2026 champions with trauma guidelines. And today we're going to discuss more about luxation injuries in pregnant teeth. And we're going to have a short quiz, a short mock exam at the end to test, guys, your understanding about this topic. Guys, are you ready? Hi, Dr. Tasneem, how are you going? Dr. Manvir, how are you going? Dr. Shipa, Dr. Rohith, Dr. Purnima, and Dr. Albert, and every one of you guys. You are, like these names, guys, Dr. Neshma, Dr. Tasneem, Dr. Sepia, Dr. Seida, and every one of you attended today. You are very special champions. Why this? Because based on my experience, I know the candidates starting their journey like you and paying attention and put effort from the beginning like you, they are the champions. They pass the exam. Yes, Dr. Sharia, how are you going? I love the smile, Dr. Sharia. So guys, I'm really feel proud in every one of you, for every one of you guys. Let's start. Ready? Guys, are you ready to start the preparation for 2026 September exam? Let's see now your answer. Yes, I love to hear this. I love to hear this, Dr. Sepia, Dr. Manvir, Dr. Neshma, Dr. Tasneem, definitely, I pray for you. Okay. Do something on Zoom. The chamber love to play. Dr. Katra, Dr. Vipa, they love to play. Let's start. Let's start here. So guys, today we're going to start with luxation injuries. In luxation injuries, based on ADC exam clusters, because in ADC exam, they have 4 different clusters. Can you guys tell me what are the 4 different clusters in ADC exam? So you should pass the 4 clusters. And we're going to have different session about this part, by the way. We're going to discuss the difference between every cluster. Very good. Professionalism is one of them. What is second one? What is second cluster? Very good. Information gathering. And then diagnosis and management. And then treatment planning and evaluation clusters. That's why I found it will be easy for you if I divide trauma guidelines into three main clusters: information gathering cluster, and diagnose clusters, and then treatment, planning, and treatment and evaluation cluster. Let's start right now. I will start with information gathering and diagnose clusters. Guys, can you see my file? Again, you may or may not find this information in books. So I made this, guys, for you to make it easy to remember what we discuss about. What is, guys, the first injury? This, guys, is here right now. It is luxation injuries. As you see right now. Guys, are you able, guys, to read the file? Now, the first injury is concussion. What does it mean, guys, by concussion? What the scenario will have as a sign and symptoms. So when I say the information gathering, means what sort of clinical feature, what sort of signs, symptoms, X-ray findings, bulb sensibility findings. So what is called is information gathering and diagnose cluster. So if in exam you have a question related to information gathering cluster, most probably the question will ask about one of these. Am I, guys, clear about this? Guys, am I clear about this? Very good. So let's start with the first, laxative injury. Guys, laxation injuries, that's I will discuss today about this laxation injuries and no more than this. Laxation injuries is 1 concussion, 2 subluxation, 3 intrusive luxation, and then lateral luxation, and then intrusive luxation, extrusive, and then intrusive. These are the 5 luxation injuries. Avulsion, we'll discuss it later on because it's very important topic. That's why I make it separate. And then tooth fracture or tooth root fracture will be separate session as well because it's separate, its own entity as well. So now, luxation injuries. The first one is conclusion. Sorry, conclusion. Concussion. In concussion, guys, amount of trauma. Patient got a trauma on the face. Do you think it is mild or severe type of trauma? Just a mild. If there is concussion, what can happen as a part of clinical feature? You will find the periodontal ligament has a little bit of disruption, just a little bit. Do you think with concussion, like this type of tooth, look at it. Seems like normal to me, right? Seems like normal. Do you think if there is just a mild disruption to periodontal ligament, if this is going to affect the periodontal ligament the way that the tooth start to be mobile or displaced, no. So in this case, in concussion, it will be just a mild trauma. Okay, guys, tell you something. Every one of you right now, get the finger, okay, guys, your tip of finger, and gently hit your front, one of the front anterior teeth, upper or lower. Can you guys do this for me? With your fingertip, hit gently, gently, the upper central incisors, or lower, wherever you like. Guys, did you do this? What you did right now is concussion. Trauma, resident concussion, and it's very mild concussion. You felt it, but disruption has happened to periodontal ligament right now. It's more into sensation rather than actual trauma. In this case, do you think your tooth has been displaced? No. If you are very strong, it may be. I don't know what did you use to do it. If you just your finger, nothing gonna happen. Do you think you ended up with displacement? No. Now, if you try now to do percussion, I don't think you will have pain or even tenderness, just a mild. You may feel a little bit of mild tenderness or maybe not, or a little bit percussion, but no pain. Why do you chew? Guys, there is any echo, guys? Dr. Singh mentioned the audio had a lot of echo. Guys, there's any echo, I can fix my stuff now. There is echo. It sometimes happens. No echo? Maybe Dr. Singh can please check your, because Dr. Sevi say no echo. If possible, can check with your mic and then no echo, Dr. Neshma. Okay. You know what? Even what will I do is I will stop my Zoom here. I think now even it's okay, right? Even guys, Dr. San even say no. That's very good then. Okay, guys. So this concussion. So in this case, do you think, guys, bleeding has happened when you hit the tooth? No bleeding has happened. Do you think there is any alveolar bone involvement? No. Now, pulp sensibility. Do you think, guys, pulp sensibility has been affected? No, it's normal. X-ray finding, if I take a photo for the tooth you have hit right now, do you think there is any abnormalities on any per-epic radiograph, guys, recommended? No. Now, guys, is it concussion clear to every one of you? Will you never ever get confused about concussion again? Let me check the answer. It's better than the sound. Thank you, Dr. Bishoy and Dr. Patel and everyone. Okay, guys? So now, guys, are you gonna get any confusion to understand what's concussion? Clear, guys, Dr. Neshma is clear to everyone, right? Very good. This is concussion. We finish with one diagnosis. Let's discuss the treatment of concussion now. Let's move to the treatment for concussion. So, guys, what do you think? Do you think the tooth you have hit right now for yourself, do you need resplentin? No, because tooth hasn't been displaced, the periodontium hasn't been affected, the bone hasn't been affected.
medication. Analgesic, it can be. Maybe yes, maybe no. Depends on how severe it was. Antibiotics only if there is deep soft injuries, but you haven't done any deep injuries for yourself right now. So no even antibiotics. Advice, soft diet for 1 week. If it is a little bit severe, but what you have done to yourself, it's not severe. Gentle brushing if there is pain, otherwise you don't need. Next visit, after how long? 1 month. Why? Because it's just a mild. 1 year with vitality test x-rays if you have signs and symptoms. The pulp is normal. That's a good clinical signs. No pain, no persistent discoloration, no matose growth. Unfavorable, unlikely to happen in case of concussion. Unlikely, really unlikely. Pulp necrosis, infection, or pain, or bone resorption, or root resorption, or ankylosis. Unlikely to happen. Least likely. When exactly you can do RCT if there is necrosis? That's it for concussion. Is it, guys, hard to know now the treatment and the evaluation, guys, of concussion? I don't think so. Are you ready now, guys, to move into subluxation injuries? Subluxation injuries, it's somehow similar to concussion, but the only difference is you will find the tooth has a little bit of mobility. Why? Because there is mild to moderate rupture of periodontal ligament. So now, give you guys a good hint. I will give you a good hint. Do you know what are the most two important factors going to decide on the diagnosis and the treatment? I know, guys, you're very smart and you can tell them. There are one basic important factor will affect a secondary important factors. They all together two important factors. These are two important factors will decide to you the diagnosis and the treatment. The diagnosis, signs and symptoms, and findings, and the treatment. Do you know, guys, what are these two important factors for every laxative injuries? Okay, I will make it easy for you. I see most of you, Dr. Panita, Dr. Nishma, Dr. Sen, Dr. Um, Sondos, Dr. Pato. Most of you guys will say two things: bleeding and cervical bleeding around. Bleeding and displacement. I see most of you guys going with mobility and bleeding or bleeding displacement. Totally correct. But the two primary factors: one, the trauma magnitude; two, the effect on the periodontium. Okay, guys, what are the two most important factors? The primary and secondary two important factors. One is the force of trauma or trauma magnitude. The second is the effect of periodontium. How is this? Think about it. Let's take the two examples, two diagnoses we have made right now. So guys, can you guys please first tell me what are the two most important factors? The primary factors? So positive, Dr. Arpit. Yes? Thank you, Dr. Bishoy. The force of trauma, which is force of, yes? Force and effect on periodontia, Dr. Fatima. Perfect. Magnitude of trauma and effect of periodontium. Perfect. Let's apply these two things right now. You will see, based on this, I see Dr. Selvan as well mentioned the same things, which is perfect. Based on two things, based on these two things, you can tell what is the diagnosis and definitely the treatment. Let's apply this. Because in concussion, we have very mild trauma magnitude that result in very mild disruption of periodontal ligament. That's why mobility has happened. That's why displacement hasn't happened. That's why, because periodontium hasn't been disturbed a lot. There's no disruption in it. Disruption in it. That's why the tenderness was too low. That's why the bleeding wasn't existent, because force was low. The force couldn't disrupt or disturb the periodontal ligament or periodontium. That's why all this has happened. Let's apply the same things on subluxation. What has happened is the forces in subluxation has increased a little. The forces was mild to moderate. Because the force was mild to moderate, it does result in what? Rupture of periodontal ligament. And it was mild to moderate. Because the mild and moderate forces has resulted in mild and moderate rupture of periodontal ligaments. Periodontal ligament will result in mild mobility, just or no displacement. Mobility without displacement. Because the rupture has happened in periodontal ligament, that will result in sensitivity to percussion, because it was moderate rupture to periodontal ligament. Because the moderate rupture has happened, it will result in mild bleeding around the gums, like this. And do you think the alveolar bone will be involved? No. Why? Because just was mild. Only affected the periodontal ligament, but not the bone. Now, it was just a mild force. That's why the pulp sensibility will be negative due to inflammation. But if you look at the X-ray, you will find it's normal. Why? Again, because it was mild rupture to periodontal ligament. Guys, am I clear, guys, about this point right now? Did you understand that how the two primary factors has affected the rest of the findings? So let's conclude this again. In concussion, the force was just very mild. Hasn't really affected that much of the thing. Things like mostly normal. But because subluxation, the forces was mild to moderate, has affected the mild to moderate rupture of periodontal ligament. And if the effect only in periodontal ligament, you will find mild mobility, but no displacement, because the bone hasn't been affected, and it's just a little bit of mild rupture to periodontal ligament. Now, sensitive to percussion, yes, because it still had rupture to periodontal ligament. And then bleeding around the gums, on the sulcus, will happen because there is a moderate rupture. And then the bone hasn't been affected because the force is low forces. Negative due to inflammation, yes. It can be positive sometimes, by the way. And then normal findings. Why? Because the bone hasn't been affected, just a mild. Is that guys clear to you right now? Let me check. Yes, Dr. Bishoy, mostly is no, because it's just a mild. Because the periodontium has just a mild or periodontal ligament, just a mild disruption, not really mild to moderate, not severe even. Okay? Let's now move to the third. Okay, treatment. Let's move now to the treatment. Everything mild to moderate. Now, treatment. Splinting. We mentioned it has mild mobility. If there is any, but there was no any displacement. In this case, usually not required splinting unless loose tooth, if it's loose. In this case, if it's really loose, you need to do the simplest way of splinting. What is the simplest way? 2 weeks flexible passive splint. What about medication? Analgesic if there is pain. Advice, same things for concussion. Now, as long as mobility happening and you put a splint, you must see the patient after 2 weeks. Guys, make this as a general concept to you. As long as there is a mobility, you must splint. Write down this. Mobility equal to splint equal to 2 weeks follow-up visit. And then you need to decide what you need to do after 2 weeks. Are you going to remove the splint, or are you going to just review and then remove a splint later on? In this case, because just a mild disruption with mild mobility, if it happens. So in this case, 2 weeks splint removal. And learn this as well. If you should see the patient after 2 weeks, most probably you will see the patient after a month, 3 months, 6 months. And then you need to do vitality testing every time you see the patient and at least one X-ray. Okay, guys? Now, I will give you this hint to help you to answer the questions properly. If there is mobility in any situation, in any luxation injury, you should see the patient after 2 weeks. After 2 weeks, most of the cases, you need to remove the splint. Sometimes you need to wait for 4 weeks. I will explain this part later on. And if you see the patient after 2 weeks, you must see the patient after a month, 3 months, 6 months, and a year. And in every visit, you should do one X-ray and vitality test. What about good clinical signs? Everything should be positive, like two-step will be stable positive pub vitality. What about unfavorable complication? Pulp necrosis, infection, pain, resorption. This can happen, by the way, in 2 to 4 weeks. You can see this of signs. Ankylosis takes longer time than 2 to 4 weeks. Treatment of unfavorable complication, RCT. Is that, guys, is it clear right now about subluxation as well? Okay, X-ray for subluxation. What you will find in X-ray for subluxation, you ask me, okay, let me just get this one for you again. Subluxation for X-ray, most probably will find it normal. What you need to take is periapical X-rays, more than one, from 2 different angles. You may or may not use occlusal radiograph, but at least periapical X-ray, 2 periapical X-ray from different angles. Okay, great. So concussion was just a mild trauma, very mild. Subluxation was mild to moderate. Let's now go with extrusive luxation. Now, the forces, guys, now an extrusive luxation, do you think mild or very mild or just moderate or moderate to severe for extrusive luxation? Extrusive, guys, means the tooth will move out. extrusive mean the tooth will be out and still laxative, like as if the tooth not attached to the bone anymore and not attached to the periodontal ligament. It just fall down, but not completely out. So the forces, guys, will be moderate to severe. Do you think if you have severe force will affect the periodontal ligament or not? Yes, it will. Is that going to be mild or moderate? No, it's going to be significant, severe. If you have significant, severe damage to periodontal ligament, do you think the tooth will be mobile or not? Yes, will mobile. Will be displaced or not? Yes, will be displaced. And then you said extrusive. So now, the direction of displacement will be vertical, outward, or inward. The word is extrusive. Will be outward. Vertical, outward. If no periodontium or no periodontal ligament around the tooth and the bone, in this case, the tooth will what? Fall down, out, fall out. If the tooth fall out, if you look at the occlusal plane like this, you will find the tooth is elongated and loose. So now, if you're gonna get the question in exam, and you see a photo like this, straight away we're talking about extrusive luxation. Why it's important to know about this keyword, loose? Why it's important to see the keyword elongated and loose? Why? Because you may get confused between extrusive luxation and lateral luxation. The key word, the difference between the lateral luxation and extrusive luxation, in extrusive luxation, tooth will be loose and elongated. But lateral luxation, and by the way, vertical outward, in lateral luxation, the tooth will be laterally displaced, not vertically displaced. And it will be elongated, but locked. The tooth will be locked, will not be loose. Why? That's what we're going to understand shortly now. Am I, guys, clear so far? Please, admin, I see there's two champions are in the waiting room. Can you please admit them? Am I, guys, clear so far, guys, about this so far? Very good. Now, extrusive luxation, severe, the forces is moderate to severe. Do you think moderate to severe force can disrupt the periodontal ligament? Yes, significantly. And if you have significant trauma to periodontal ligament, do you think the tooth will be mobile? Yes. And will be displaced? Yes. What the direction of displacement? Vertically down. In this case, tooth will be loose or not? Yes, loose. And elongated? Yes, elongated. What about pain? The patient will have moderate to severe type of pain, tenderness. Why? Because there is severe damage to periodontal ligaments. Do you think there is going to be bleeding? Yes. And there will be moderate to severe bleeding to the gums. Why? Again, because you have significant damage to periodontal ligament. Do you think the bone will be involved? So far, no bone has involved. Why? Because the tooth dropped, the force was vertically down. So the bone hasn't been affected. What do you think about the vitality test? Will be negative, often negative. Why? Because if you look at the X-ray, you will find this is the tooth crypt, the socket. And this is the nerve coming from here. Normally, when the root attached to the tooth like this, you will find there is no disturbance has happened between the nerve coming to the pulp and the tooth. But when the tooth displays down, that's a bone, guys, and that's a nerve of the apex. You will find the apex became here, and the apex will be away from the nerve. That's why, most probably, you will end up with what? Negative response. And the healing will depends on, our necrosis will depends on, have or did this nerve has been traumatized and damaged or not when the tooth fell down this way. In X-ray, they're gonna be widening periodontal ligament because severe type of damage to periodontal ligament. That's why you need to take two periapical X-rays or one plus minus occlusal X-ray. Is that, guys, clear so far? Now you can tell me the treatment by yourself based on what we explained before. You know what? Without even looking at the treatment, we gonna do it, okay? And we test ourselves. Let's do the treatment without even looking at the treatment option. Treatment. Let's keep it like this one. Splinting. Do you think, guys, we need splint or not? We're talking about this. We're talking about extrusive luxation. Do you think, guys, we need splint or not? Yes. What has happened to periodontium? Do you think the periodontal ligament has involved plus the bone or without the bone? Without the bone. Very good. So now, there is any mobility has happened? Yes. So in this case, if there is mobility and displacement has happened, do we do splinting? Yes. Bone has been involved? No. So in this case, we're going to do it for 2 weeks only. But there is displacement has happened. Because displacement has happened, we need to do something else to put the tooth back again normal position. So guys, what we need to do in the tooth? Reposition it. So now, because displacement has happened, not just mobility, so 1, reposition the tooth. 2, splint, because mobility has happened. 3, because mobility has happened, because the periodontal ligament only has involved in this, so we need to do splinting for how long? 2 weeks splinting only. Now, if we do 2 weeks splinting, so when should I see the patient, guys? Is it after 1 month like concussion, or after 2 weeks because we have done splinting after 2 weeks? If I see the patient after 2 weeks, should I see the patient after 1 month? Yes. Because if I see the patient after 2 weeks means I need to see the patient again after 1 month, 3 months, 6 months, a year. In every follow-up visit, should I do something? Yes. What do you need to do? 1 X-ray at least and vitality test. Guys, is that clear right now to you? Easy now, guys, right? No hard. Am I right? Now, displacement has happened. Moderate to severe disruption has happened to periodontium. Definitely will be in pain. The patient will be in pain. Should I give analgesic? Yes, give analgesic. Should I give diet advice? Yes, give diet advice. Look, let's check what we discussed right now. Okay, do you think on do you think necrosis gas can happen in the future or not? We said the tooth has been displaced. Any tooth has been displaced. Often you end up with necrosis. Any tooth has been displaced. either vertically or laterally or complete avulsion or intrusion, mostly guys are going to end up with necrosis. Do you need for antibiotics? No. Only antibiotics if there is deep laceration of the gums or sometimes if there is bone fracture, but this does not. Let's, guys, discuss what we mentioned right now. Let's discuss, guys, your answers. Okay, the answer is yes, we need to reposition. Why? Because it has been displaced. You have mentioned this. I'm very happy you mentioned it. The second point is we mentioned that mobility has happened. That's why we need to do 2 weeks splint. Right? If there is alpha bone fracture, will be 6 weeks, 4 to 6 weeks. But anyway, this exclusive laxation, normally there is no bone fracture happening. Least likely, unlikely to happen. What about analgesic? Yes, give analgesic if patient has pain. What about antibiotic if there is deep soft injuries only or medical conditions? Do you want to give chlorhexidine? In any laxative injuries, give chlorhexidine. Soft diet, yes, because was laxation and then was disruption to periodontium. Same things, 2 weeks splint, 1 month, right? 6, 8 weeks, 6 months, 1 year, and X-ray. By the way, learn this as well, guys. If there is displacement happen, add 6 to 8 weeks visit review. If okay, no mobility, no displacement, 1 month, 1 year. Mobility without displacement, 1 month, 3 months. Mobility plus displacement, 6, 8 weeks. Clear now, guys, about this? Repeat this again. Guys, I'm giving you keywords in your mind because I don't even want to mark up any information. I want you guys understand the industry. The industry is fun. Once you have basics, you understand the basics, you will find things very easy for you. Now, if no mobility and no displacement, I need to see the patient 1 month and 1 year. If there is mobility but no displacement, 2 weeks, 1 month, 3 months. If the displacement has happened like this tooth, you add 6 to 8 weeks between 1 month and 3 months. Clear now, guys, so far? Yes? Or should I repeat again? I'm happy, guys, to repeat if you want me to repeat. Clear right now, Dr. Neshma, I'm very happy. Clear, Dr. Shipa, I'm very happy. One more yes, I can go, I can move forward. If one no, I will repeat again. Yes, Dr. Sida, very good. Now it's yes. Okay, very good then. Seems like Dr. Fatima, yes, Dr. Wine, yes. Okay, very good then. Anyway, I will repeat again, guys, later on when we go with different things. Exclusive laxation. Now, good clinical signs like subluxation. Unfavorable complication like subluxation. And by the way, this has guys, it has a high chance. It does actually have high chance of necrosis as well, but not as bad as lateral laxation. Now, let's move to lateral laxation. Lateral laxation, guys, only guys, 2 laxation injuries left for us, and then we can do the mock exam. I have guys mock exam for you here. We can do it once we finish the lecture itself. Now, lateral luxation. Lateral luxation is somehow similar to extrusive luxation, except only few points. Do you know, guys, what's the points? Actually, the trauma is severe, not just moderate. Like here, it was moderate to severe. And the forces the trauma was mostly severe and lateral forces that may possibly end up with bone resorption. The force was really too strong that when the forces affected the tooth this way, the crown, it could be either move palatally and the root most properly moves buccally. When the force is too strong that the root will move buccally, it will result in bone fracture. And the displacement has happened here will not be vertical displacement, will be lateral displacement. And then because the bone has fractured, and then the first will be the movement space will be lateral, the apex will be locked inside the bone, trapped inside the bone. And when the apex trapped inside the bone, the tooth will not be mobile anymore. Mostly the tooth will be locked inside the bone. So now, guys, the secret between lateral luxation and extrusive luxation, one, in extrusive luxation, the tooth will be mobile and displaced vertically out and looks elongated. But in lateral luxation, the forces will be severe that may result in bone fracture, that the root will stuck into the bone, that the tooth will be displaced laterally, that once the root stuck into the bone and the bone's fractured, the tooth will be locked. Guys, if you understand these few points between lateral extrusive luxation and lateral luxation, you now guarantee to answer the scenario in exam correct if you get any of this type of scenarios. Guys, that guys clear to everyone right now? Is it guys clear, guys, difference between lateral luxation and extrusive luxation? Yes, Dr. Shiba, thank you very much. Dr. Busho, yes. Dr. Neshma, yes. Thank you very much, guys. I'm happy right now. Based on this, the treatment will be easy. Once you understood now the difference, the treatment will be very easy. Let's now move to the treatment. Ready, guys, to move to treatment? Let's now move to the treatment. You are the one gonna tell me the treatment, not me. Based on what discussed before. Now lateral luxation. One. Do you think, guys, displacement has happened or not? Guys, let's guys understand the basics. Do not forget it. I like to go slowly with you, so you will understand the basic behind the things. I don't want to make up at all. One, does guys displacement has happened or not? Yes. If displacement has happened, what you need to do? Very good. Repositioning. Thank you very much. Displacement happened, you reposition. When you reposition, how we reposition? Do we reposition, guys, by forceps or reposition by our fingers? By our fingers. How we call this reposition technique? We call it bi-digital. Our finger, guys, called digital. Our finger, it's called digital. Two finger means bi. So bi-digital. Okay? So bi-digital reposition, no by forceps. When we can reposition by forceps, if it has repositioned badly and I want to reposition back again after it has been fixed. One, displacement has happened. So that's why reposition should be done first. Two, mobility has happened or not? Yes. Do you think mobility only or mobility with root fracture? Sorry, mobility only or mobility with bone fracture? Tell me, guys, was mobility only or mobility with bone fracture? Mobility with bone fracture. In this case, if it's just mobility, we do 2 weeks splinting. But if mobility and bone fracture, in this case, do you think will be doing 2 weeks only splinting? No, because bone fracture has happened. Now we need to splint for how many weeks, guys? 4 weeks. Now, what's the treatment? Immediate treatment. One, repositioning. By what? By my finger. How we call it? By digital manual repositioning. Now, mobility has happened only or plus bone fracture plus bone fracture. That's why we need to shift from 2 weeks to be 4 weeks. So now, guys, passive, flexible splint for 4 weeks. Easy? Very good. Now, let's move to the follow-up visits. When, guys, you want to see the patient, as we mentioned, if there is displacement has happened, I need to see the patient 2 weeks to assess. Should I do RCT or not? Why? Because when the bone has happened, the nerve in the apex area has been badly damaged, discontinued, disrupted. And because of this reason, most probably need the necrosis may happen, and then you may need to do RCT. That's why, because when the bone resorption has happened, most properly, guys, you need to do RCT. Guys, you understand this, guys? So now, bone has happened. When the bone has happened, the root has been displaced badly. The apex has been displaced badly from the nerve because the nerve goes inside the apex. Now disruption has happened from the nerve relationship to the apex. That's why we need to do assessment after 2 weeks. So I see the patient after 2 weeks, 1 month, 6, 8 weeks, and 3 months, like here. Why after 2 weeks? Because RCT. Why? Because the bone has been fractured. Not every time you do RCT, only do RCT after assessment after 2 weeks. And then remove the splint after a month. And then fix 8 weeks with X-ray and vitality test after 5 years. Is that, guys, clear so far? If Dr. Hani, that's a good question. Do we need hard splint for bone fracture or soft splint is enough? If, look at this right now, that's a very good question. If there is two condition has happened, one is tooth mobility, two, bone fracture. In this case, we need to do flexible splint. Still, why this? And the longer duration, why? Because we worried if you do rigid splint for the tooth, it will end up with ankylosis. That's why we care on the tooth more than the bone at this stage. And we give flexible splint. If only bone fractured, in this case, we're going to do hard splint. Why? Because in this case, I want to fix the tooth. I want to fix the bone, not the tooth itself. So the answer, short answer is flexible splint still. Okay? If bone only, I would go with hard splint. Okay, we done with this one. Let's now move to intrusive luxation. Easy concept. Severe, like lateral luxation. What you can see is complete crushing of periodontal ligament. Periodontal ligament gone. You will find the tooth driven into other bone. It is somehow opposite to extrusive luxation. Extrusive luxation, tooth will be mobile. Intrusive luxation, mostly, no mobility. It's opposite way, completely opposite. Extrusive luxation, you will find there's vertical outward displacement. Here you find vertical inward displacement, inward. In extrusive luxation, tooth will be elongated. Intrusive luxation, tooth will be shortened. No mobility, short tooth intrudes inside the socket. Severe pain, minimum bleeding. Why? Because it went inside. But still, bleeding, but not as bad. What happened? Necrosis will happen. Do you think fracture can happen? Sometimes fracture can happen. When you look at the X-ray, you will find widening periodontal membrane? No. But extrusive luxation, lateral luxation, you will see a little bit of widening periodontal membrane. And definitely here, you will find a little bit wider periodontal membrane. Here, you don't find widening. So, extrusive luxation, there is widening. And periodontal membrane. Intrusive luxation, no widening of periodontal membrane. As you see right now, no widening. No widening. But extrusive luxation, or even lateral luxation, will find widening in one side only, not two sides. Now, what do you think is the treatment is? Easy. Now we can tell the treatment. Easy thing. Now, has displacement happened, guys? Has displacement happened? Yes, displacement has happened. If it's mature, right, and displacement has happened, we need to think about how much displacement has happened here. If mature tooth, mature, if displacement less than 3 millimeter, don't do any repositioning. But if it's more than 3 millimeter, do surgical repositioning. Because sometimes your finger cannot take it out. This one, if there is 3 millimeter displacement, you're going to have surgical repositioning or orthodontic repositioning. Surgical preferred, quicker. If it is less than 3 millimeter, it's mature. Just let it to erupt. Wait for 8 weeks. If no improvement has happened, right? If no improvement has happened, in this case, you do surgical repositioning. And a splinted will be needed. What about if it's immature? Don't do any repositioning at all. After 4 weeks, you may need to do repositioning. Which sort of repositioning? Surgical repositioning. Splinting, 2 weeks. Why? There is no bone resorption. Sorry, there is no bone fracture. So now 2 weeks, and then assess the RCT. For mature teeth only, you can provide 1 month splint if required. In 1 month, a splint removal. 6-8 weeks, because displacement has happened. 3 months, 6 months, 1 year, and then the rest as lateral luxation. So now 2 weeks assess for RCT, exactly like lateral luxation. 1 month for mature teeth only. Otherwise, immature, no RCT. 1 month is splint removal. Gradual re-eruption, positive pulp vitality only immature teeth. Most properly for mature teeth, you will not find vitality test be preserved. And then the rest is rest. Like the rest will be the rest as above. Guys, how is guys laxative injury right now? The trick mainly is in lateral luxation and in intrusive luxation. That's only the trick in this part. And then the same will be similar. Let's guys move into the mock. Guys, are you ready guys for the mock? Guys, ready guys for the mock? You know guys, one more. Listen to this lecture. One more time. Oh, 1 to 20. Okay. You know what guys? Because this is the first session, what if we can do this mock next session, guys? Take a break because we just learned the system. Take a break, guys, for today. That is very good for today. What we have discussed as a first session for trauma. I don't want guys to push you too much. We just starting. We just start from scratch. It's good for today. We're going, guys, to do the mock discussion next session. I will be announced with the mock session. Okay, guys? Because I don't want to guys push you for now. Let's make the thing slowly, nicely. Don't push yourself because you're gonna feel tired. Just listen to this session, and then guys you will feel better, and you will be ready for the mock, and then we can answer the mock together. So I want you to score 100%. Okay? Do you want to break your fast? I want it. It was 1 hour and 15 minutes ago, but that's okay. Okay, guys. Thank you very much, guys, for the session today. I'm going to announce when going to be next session for the mock discussion. Most probably will be soon. Okay, guys. Thank you very much, guys. I'm very happy, guys. On Saturdays you attend the session. I'm very proud of you. That's guys. You have attended the session on Saturdays, and the exam is still after 6 months, and you started, guys, a journey. I believe if anyone gonna pass the exam, you should be you in the beginning. Thank you very much, guys. Thank you, Dr. Sondos. Thank you, Dr. Panita. Thank you, Dr. Swati. Thank you, Dr. Iman, Dr. Sondos, Dr. Abhinav, Dr. Saida, and Dr. Jasmine, every one of you guys. Thank you very much, you guys. See you. I did learn so more tricks in trauma. Thank you, Dr. Fatima. I'm very happy to do this. Thank you very much, you guys. Thank you, Dr. Tasneem. Let's have more mock questions in the next lecture, Dr. Bedo. Yes, we can have lots. Thank you, Dr. Joy, Dr. Sangeeta, Dr. Bishwan, and every one of you guys. Thank you very much, you guys. Have a great night then, guys. Thank you very much. Bye-bye. Bye. For all our candidates, guys, we now start to move you on Telegram group to get the benefit, guys, from the course, because we started now the course for September and March candidates. So, guys, yes, you will be added on Telegram group. We work on Telegram group right now, and we work on the drive and the website, guys, to give you all the materials and things slowly. Okay, guys? Thank you very much, you guys. Have a great night, every one of you. Thank you. Bye-bye.